reason is that this is a big presentation. You know, I teach a CME course, Yoga Therapy for Sleep Apnea for physicians. And there's a lot of slides. I'm going to skip few slides, the content of the slides. So I'll share with you. And that's what I've been doing. In fact, I've been doing it since 2011. So it's a long, long time back. It's a new subject for everybody. And let me see if I can go back to my slides. So get ready. And okay, you tell me what is there. I see you, I don't see me. What is happening here? I know there's a little technological challenges, but we are getting over. One more time. Let me see, speaker view. Let's go to a gallery view. So if I go to a gallery view, I can see both of us. Okay, share. Let's see if I can go back. Okay, do you see me or? Or I
see both you and the slide.
You see, I'm only seeing you. I don't see, for some reason, I'm not seeing you. Let me start one more time.
I don't have a camera attached to this computer terminal.
That's okay. I'm seeing a name. That's good enough. I'm just trying to see. Okay, let me. I'll share it one more time. Go back. Let's see. We're in a gallery view. I'm in a gallery view. So more wine has joined. Okay. Let me start. Let me go ahead and share slides again. Let me know if you share, if you see my slides now, the first slide will come up. Okay, this is the first slide. Do you see it?
Yes.
Okay. Okay. This is what, about 3 minutes past. I cannot see all of you because I'm the speaker. Should I go ahead and start, or you tell me when to start?
This is fine, sir. You're good to go.
Okay. Good morning. Thank you for joining this virtual presentation, Yoga Therapy for Sleep Apnea. This is for your Sleep Medicine Fellowship Didactics. This is a new subject for, I'm sure, all of you, but it's not new for the fellowship. I've been teaching this topic since 2011, almost 9 years. I'm doing every year except 1 year when we did not have a fellow in our fellowship program. Let me introduce myself first. I've been to this Hampton Road community for close to 45 years. I was a practicing vascular surgeon, and I was also in the faculty in the Eastern Virginia Medical School. I retired as Associate Professor of Surgery, you can see on the first slide. And now I primarily teach how to integrate the philosophy of yoga therapy with the science of Western medicine, primarily to physicians, healthcare providers, and also yoga therapists. I've been a past president of Board of Directors for American Heart Association, another called International Association of Yoga Therapists. And my contacts are here in the bottom, my mobile number, my email address, my website. So if you have any interest, if you have any question, you can call me, connect with me. I also wrote a book on this subject. The book is called Yoga Therapy, Ayurveda, and Western Medicine. And if you can see, this is the book. And the book is in your Amazon, both the hard copy and the Kindle copy. And book is doing very well. It's almost like a textbook. It is actually written for healthcare providers. There's all the pictures, my pictures, and the indications, and the practice, and the physiological. Somebody is having little feedback. If you can mute your microphone, that will be the best way. I also have a DVD, same way. So let me, somebody who's using a phone, can you mute your phone? That would be the best way to, so not to have the feedback. Okay. So let me tell you a little story how all this thing started. So I've been teaching this yoga therapy for sleep apnea as a CME course, continuing medical education. I do it in little outside Baltimore. Doing it for a long time, since 2010. And I was also doing a radio talk show program. And suddenly I got an email from a person who said, you know, you have shown a breathing technique, which we do in our yoga practice. It's called the victorious breathing. And the name, Sanskrit name on the subject, yoga is written, it's called Ujjayi Pranayama. And he said, you know, I've been practicing it for a while, and he had a CPAP machine. And one day he falls asleep. And next day he woke up, he did not use the CPAP machine. Since then, he's using that same breathing technique. And this breathing technique, you know, when I'm with you guys together, I show it live, it's just gently contracting your larynx and try to breathe in. And most of you know that, you know, somebody playing an instrument like called DJs, they don't have much of a sleep apnea. And we have also noticed a daily practitioner of yoga and the yoga practitioners really do not have the insomnia and sleep apnea. It's a sort of like an observational science. So I just want to demonstrate you one time so you'll understand what I'm talking about. And let me tell you a little physiology behind it. So you constrict your larynx slowly. You try to stimulate the superior and inferior laryngeal nerve, which are primarily a part of vagus nerve. And vagus nerve, 80% is the afferent. It goes to the brainstem. Then the efferent comes out through your glossopharyngeal nerve and hypoglossal nerve. The glossopharyngeal nerve then can activate your palatoglossus and palatopharyngeus muscle. It tightens up the muscle, and it almost controls your snoring. It's almost like the operation we do called UVPP. And hypoglossal nerve also stimulates tongue, pushes it in the front, and there is a tremendous outcome of this breathing technique. So just show you a little technique. I'm trying to close my larynx and trying to breathe in. I will show you more and more when we progress and your study. So let's move on, and I will present maybe next 35-40 minutes. And if you have any question, I'll be glad to answer those questions if you have. And then, so when I was presenting to the Sleep Medicine Fellowship Program, we had a program director, Robert Verona, and he invited me to Virginia Academy of Sleep Medicine. It was almost 2014. I gave the same topic, yoga and sleep apnea. And I also came to visit your place when you had the sleep lab, and I personally wanted to have a personal experience and how the CPAP feels like. This is the one me here, and this is Dr. Verona showing me the sleep lab. So why we are so much interested about sleep apnea and insomnia? As you'd all know, the sleep apnea is the root cause for all of our chronic lifestyle-related disorders. We call it a metabolic syndrome, which consists of truncal obesity, diabetes, hypertension, atherosclerosis, heart disease, and dyslipidemia. Dyslipidemia, we call it a high cholesterol, and then high triglyceride and low HDL. So what is the connection? The connection of insomnia and sleep apnea, we call it a hyperarousal of our brain, and primarily the area which is called an emotional brain, which is beyond our motor and sensory brain. We call it a limbic system. In a limbic system, we have two nuclei called amygdala and hippocampus. Amygdala responds to fear, hippocampus responds to memory, and then you get a fear of unknown. We call it a stress, and it is your sympathetic overdrive. And a sympathetic overdrive in a stress, and the pathway is called psychoneuroendocrinology. It affects limbic system, then through the neurotransmitter, body tries to do homeostasis, it goes to hypothalamus, hypothalamus sends a signal to the pituitary, and we get a more cortisol. The high cortisol then first produces your omental fat, which is intra-abdominal. That omental fat then secretes inflammatory molecules to cause this gamut of metabolic syndrome, diabetes, hypertension, heart disease, and dyslipidemia. So on the other hand, what happens, the practice of yoga, which you see, a posture called asana, a breathing technique called pranayama, and your relaxation of the mind, we call it a meditation. Primary is a relaxation response. Primary, it is the activation of parasympathetic tone. It is totally opposite of exercise. In an exercise, you use the muscle, in and out, and it is a sympathetic. Your heart rate goes up, blood pressure goes up, respiratory rate goes up, and you develop a very high sympathetic overdrive. The body starts to create a homeostasis. It brings a parasympathetic tone. So your heart rate comes down, blood pressure comes down. But in a yoga practice, it's a primary activation of parasympathetic tone. That's why it is so effective in insomnia and sleep apnea. It's almost like a therapy these days we are recommending. So let's take a few minutes to see what is meant by yoga. Yoga actually is an anglicized version of a Sanskrit word called yoga. It is a philosophy. The philosophy is called Yoga Sutra of Patanjali. Patanjali is the writer. Sutra means small aphorism. The 196 sutras, of which 193 is quieting down your mind. It talks about your mind. It has a practice called 8 limbs of yoga, called Ashtanga yoga. These are the 8 limbs, but most of the time we use called the posture, asana, breathing, and meditation. And I'll go over with you slowly what does this mean. Our Western medicine, as you say, it's an evidence-based medicine. And show me the number, show me the data. But in yoga therapy practice, we call it a practice-based evidence. It's a part of integrative medicine. And you'll see today, about 100 medical schools has a department of integrative medicine. 15 years back, there was almost only 3 medical schools having it. Since 2014, we're having a board of integrative medicine. As I said, it's a relaxation response, activation of parasympathetic tone. It is experiential, which is the creator of your destiny. And it's a daily practice and a lifestyle. And we'll show it to you, the lifestyle we do, which is called a daily routine. What we do in the morning. When you get up, we sit down like a squatting pose, we drink a glass of water, there's a proper elimination, we do a scraping of the tongue, then we clean our nostril. It's called a gel neti, called using a neti pot. And you will see that all the yogis do every single day. It's like a brushing your teeth. They will do your clearing of your nose, cleansing of your nose, because in the morning you wash your face, wash your hair, wash everywhere. Why not your nostril? Then also the practice called oleation. They put a little oil inside the nose. The idea being that when you are sleeping at night, generally they do before they go to bed, sleeping at night, your mucosa gets dried up, then you get obstruction of the breathing through your nose, and you start having a mouth breathing. Mouth breathing starts with your snoring. It is a precursor for your sleep apnea. And this is called a science beyond science. We call it transcendental science. And it is also experimental, like a personal practice. I have this book, How to Integrate Yoga Therapy in Western Medicine. If you're interested, you can look at the Amazon, and it is in the Amazon. It is a lifestyle. It is a lifestyle, and we do it every single day. And the practice is not what you think about, that somebody is in a yoga studio and they're putting the body in the shape of a pretzel. That is not the yoga therapy. Your therapeutic part of yoga means it's adaptation of the same tool, same practice of yoga based on the patient's clinical condition. So we meet where you are. Then we slowly do in stages the postures, called poses, called asanas. And you get into the stage without any pain. If you create a pain, you have created an imbalance, you have crossed your limit. And also when you create an imbalance in a physical body, it shows up in your breath. Your breath becomes with an effort. So when you have a staged approach of putting the body in different postures for relaxation, primarily I'll show you some pictures to keep your spine straight when you sit down. I'm sitting here and my spine is straight. Effortless breathing, which takes you to the state of meditation. And meditation primarily we call at the time that all the medicine cabinet of our mind. So this is the message for you to take as yoga practice, not to master the posture, but use the posture in stages for transformation. The pathway, as I described, is called psychoneuroendocrinology. It affects your limbic system, and limbic system is amygdala and hippocampus, sends your neurotransmitter to hypothalamus. Hypothalamus sends a signal to your endocrine system, pituitary gland, adrenal cortex, and it also affects your autonomic nervous system, creating more parasympathetic outflow and a very quick shift from sympathetic to parasympathetic output. So the final pathway we call correction of the altered hormonal homeostasis and correcting the autonomic nervous system dysfunction. The effects, I'm not going to go in details, but it also controls epigenetics. What does it mean? We have a genetic mutation in our body. My parents have diabetes, my parents have hypertension. I'm going to have a diabetes and hypertension, but gene has to express. A practice of the relaxation response causes genetic suppression, and I'll show it to you. And this is a reduces expression of genes. It controls apoptosis, controls telomere length. It almost acts like an anti-aging. And I've been with the yogis everywhere for a long, long time. All the long-term yoga practitioners looks a lot younger than her chronological age. It's a relaxation response. There's a lot of stages of the asanas, but it's a more of called neuroplasticity. What the neuroplasticity is in stages, and if you have an input in the brain slowly knows that that's the way you need to sit down. That's the way you need to talk. That's the way you need to push your tongue in front. And about 30 to 40 inputs to develop this neuroplasticity. So it also increases heart rate variability, which is a function of parasympathetic tone, and reduced heart rate variable sympathetic. It activates the baroreceptors, and I'll show it to you how it affects your sleep apnea and insomnia. What it is we practice is called the inversion poses in stages. When you put the head down, our pressure inside the brain called intracranial pressure, intraocular pressure, pressure on your carotid arteries, it all goes high up. But if you keep your head down and do a gentle breathing, and most of the breathing we call exhalation longer than inhalation. Reason being, our lung is like a balloon. It has a 4.5 liter vital capacity, 1.5 liter residual space, almost 6 liter capacity. We only breathe only 500 cc tidal volume. So when you breathe out longer, that is parasympathetic. Breathing in is sympathetic. So keeping our head down slowly and slowly, it activates the baroreceptors. Pressure starts to go down inside our head, inside our eyes, inside our carotid arteries, and slowly body goes high up, and it creates a tremendous homeostasis to be able to do the inversion poses. It also suppresses your chemoreceptors. So all the breathing changes does not affect properly, and it's a very important tool for sleep apnea. This is just to showing the heart rate variability goes high up, and just to show that your inhalation is sympathetic, exhalation is parasympathetic. In simple, pure computer term, we say we have a body, mind, and spirit. We call it body is the hardware, mind is the software, spirit is the program. Simplest way to say, if you take care of the software, your mind, hardware gets corrected. And I will tell you just slowly what the mind means in yogic term and how it affects your sleep. And this is just one very simple statement called the Academic Consortium of Integrative Medicine, where they say the integrative medicine is a relationship between practitioner and patient, focuses on the whole person, looking beyond the body and mind to achieve optimal health and healing. And I'll be showing it to you more and more how a relaxation practice in the neck affects your sleep apnea, how a breathing technique affects, improves your insomnia, how able to control your 5 senses and able to create a vibration, how to control your mind. So this is very important concept. Even our father of our medicine, Hippocrates, said, it is more important to know what sort of person has a disease than to know what sort of disease a person has. And we as a yoga therapy, integrative medicine practitioner, we are also not interested about the disease. I'm not interested about your sleep apnea. I'm not interested about insomnia, but I'm interested about your whole body and the whole person. And I'll show it to you more and more. This is just to show you in the PubMed, if you do it, put a yoga therapy, about over 5,000 articles will come up. There's a clinical trials by NIH on yoga therapy, about close to 400 studies with being funding. This is called a mind-body hygiene. what happens if you don't brush your teeth for a whole month. It is a personalized lifestyle changes, and it's synergistic and it's transformative. What it transforms a patient to a, call it rogi, it's a Sanskrit word called rogi to nirogi to yogi. Rogi means people with disease, nirogi means people are healthy, yogi means they're enjoying a quality of life and been practicing an active lifestyle. This is a picture, a friend of mine gave it to me. This is called Michelangelo's David. After 2 years visit to United States, this thing happened to Michelangelo. The fellow who did the photoshopping did a great, if you can see, created this, the truncal obesity, and looks like a classic person who has going to have a sleep apnea and a metabolic syndrome. You will notice one thing, I'm not showing it to you for a sleep fellow, that if you can control a truncal obesity, a sleep apnea gets controlled. And I'll show it to more and more patients. So let's talk about a few minutes. What is the yogic concept of sleep? So as you know, the mind in yoga is called your content of your five senses. We have five senses. I hear, I see, I smell, I taste, and I touch. If you put all the senses, that is your mind. When the mind is hyperactive, you develop insomnia. When mind is also hyperactive, you develop the physiological changes of your sleep apnea. So we use the word all the time. The mind is a consciousness. Somebody is unconscious, we call it a senseless. So in yoga, mind has 4 stages. First is called erect. Next is your dream. Then is your called a sleep. Then it's a beyond sleep. It is called a turiya, transcendental state. Generally, we see from physiological standpoint, this is the 4th stage of your non-REM sleep. So if you can see, you know very well the sleep, non-REM is about 75% of our sleep. It is in a stage 1, stage 2, stage 3, stage 4. You can see the stage 1 and stage 2 is a big chunk of your sleep. But in a daily practice of the relaxation response by yogis, they always stay in a stage 1 and stage 2 throughout the whole day. So when they go to even sleep, they actively go into the stage 3 and the stage 4 of sleep, and they really don't sleep too much. So it is a very important, and we find it out that all of you know that in a REM sleep, rapid eye movement sleep, the mind is still active. Your heart rate is up, blood pressure up, respiratory rate is up, and this is the one non-REM stage 3 and stage 4 sleep when it really corrects your insomnia and sleep apnea. I'm putting the term together because they are connected so much, and separating insomnia and sleep apnea is not going to be any different. So how to control your mind? Well, I'll show it to you. We call it a relaxation of the physical body. We do it all the time. We relax our hand, relax our wrist, relax our shoulder, relax our neck. Then we do effortless yogic breathing. Yogic breathing is a slower breathing rate. Exhalation longer than inhalation, and also have a breath holding power. And I will show you the techniques, how we use it all the time. And I'm going to show you all the practices we do. And the first, in yogic lifestyle, every morning, brush our teeth, then we do tongue scraping. And then there we use a neti pot. And beyond neti pot, we also use a little thread. And how we do it, when you put the water in your nostril, initially, there is a lot of irritation. But again, if you keep on staying here, initially you have a lot of burning in your eyes, you have a watering, burning in your face. But slowly and slowly, you will see a neuroplasticity sets in, and you don't feel the irritation anymore. When you don't feel the irritation anymore, you breathe in through your nostril. In yoga practice, all the breathing is through your nostril because the nose is your personal air conditioner. When you breathe through your nostril, first, all the air gets filtered. Then if the outside air is cold, it gets warmed up. If the outside air is warm, it gets cooled down. Then there is an organ on the side called your turbinates. It directs the air in the larynx and towards your lung. And also in the nasal breathing, there's a lot of studies done today which shows it secretes the nitric oxide from your mucosa of your sinuses. Nitric oxide is a powerful vasodilator. So if you breathe in through your mouth, you don't know where the air has gone in. The air has probably gone into your stomach or the lung, but if you breathe in through your nostril, all the air has gone inside your lung. And slowly, all the muscles of respiration are skeletal muscles. We train them how to do a little longer and longer inhalation, longer exhalation. We easily can do count of 2 in, count of 4 out, then we do count of 3 in, count of 6 out. We've been practicing so long, we can easily do count of 10 in, count of 20 out, and then our breathing rate drops down to normal, 15 to 16 to 12, then to 10, then 9. I have almost 5 or 6 breathings per minute. So this is the tongue scraper we use, and for my practice, I use every single day. Slowly, I took it to the back and massage it, and it is very important. All the coating goes away. It even stimulates your tongue. It is one of the powerful therapy for your sleep apnea. This is called a neti pot. It's a pot, it's a porcelain. We put a little warm water, lukewarm water, then you put a little salt. The salt is primarily a non-iodized salt. Then you put it through one nostril. We close our eyes, keep our mouth open, breathe through our mouth. Initially, no water comes out because this is a relaxation response. Your nasal mucosa is like your erectile tissue. More you're excited, it gets more swollen. So when the relaxation response sets in, then you will see the water is coming out. See, for me, I demonstrate it all the time when I'm doing my CME courses for the physician. It is a complete stream coming out. That means I'm totally relaxed, and it is a very, then we do it from the other nostril, then we blow it up for a short time and clean our nostril. This is the next technique called Sutra Neti. Sutra Neti, Sutra means thread. We put a little small red rubber catheter. Takes a little time. Initially, when you bring the catheter close to your nostril, you get a lot of irritation, but slowly and slowly, neuroplasticity sets in, irritation goes away, one end comes out through your mouth. Literally, you are flossing your nostril, you are coming out, a wonderful way of keeping your nostril open. This is another technique what yogis do. It's called oleation of your nostril. Here, I keep it a little bit of the oil. This is a Indian oil, not an oil, it's an edible product. It is called clarified butter. It's called a ghee. And I keep, these are entirely my personal practice. Nobody even knows I'm doing it. I'm in my bathroom. I do a lot of things which are all antisocial. I can even show it to the public. Like this, I do it for a daily practice. And at night, before going to bed, and this is a very gross picture, but this is a very powerful tool. We take a little bit of this oil called a clarified butter. We use our little finger. We go all the way up to the nostril, and we just oleate the whole nostril on the both sides. And we have noticed it. Next day morning, when you get up, if you get up in the next day morning, if your mouth is dry, that means you have been a mouth breather, and this is a precursor for your sleep apnea. With this, the nostrils are oleated. There is no dryness. And remember, the opening in the nostril is so small because if you put those nasal strips called the Breathe Easy, it opens up only 0.3 millimeter. It increases about 35–40% of your breathing. There is a couple of nice articles about called the Sutra Neti for snoring and obstructing sleep apnea. And the the practice, what we do, I'm going to show you a little bit more. We have about next, say, 10 minutes. I will show you a little bit more practices. See, the first relaxation response is able to keep your spine straight. So when I sit down in a chair, I always keep my spine straight. Even if I sit down in the ground, when I do, I teach a class at 9:30 in the morning. And in that class, I show them how to keep your spine straight. So once you keep your spine straight, that your muscles in the back, which is keeping you straight, gets a relaxation. Initially, it feels like I have a too tight, like a brick. Slowly and slowly, it becomes like yours, like a two pillows sitting on my side. My hand is connected to my mind because we talk with our hands. So we have a called a hand gesture called Mudras. We close our eyes because we feel that five senses, hearing, seeing, smell, taste, and touch, keeping us very active. This is a morning practice we do. We do a little bit of a yogic breathing, exhalation, longer than inhalation. Then we create a vibration. I will show you to create a vibration called Bumblebee Breathing, or there's a sound in yoga called Om. And those two frequencies has the same frequency as the frequency of your brain. Two frequencies interacts and it's called a harmonic resonance. It quiets down. When you're practicing that daily, your insomnia gets controlled. It's very, very important. So these are very important. You know, we do the called slowly in stages, the grounding poses. Like, let me show you what it is. When I started doing it, I could not even sit down. The first one is called the easy pose. My knees are way high up. But what I did, I kept it up, but I stayed in the pose. I did my breathing out longer than breathing in. Slowly and slowly, I could sit down with my cross-legged. This is called easy pose. Then I could even put one foot high up, called a perfect pose. Slowly, you will see in stages. My another foot goes high up, then both the feet goes high up. This is called a lotus pose, Padmasana. It is a powerful relaxation response. This only happens that not trying. If you try to do it, you won't be able to do it because of the tightness. Then we call it a relaxation response. Is almost like a preventive medicine. It creates your health. Very important phenomenon. This is one thing we recommend for both all the people with the insomnia, sleep apnea. This is called pumping and cupping of your eyes. As you see, we are trying to take care of our whole body and a mind as a therapy for insomnia and sleep apnea. We rub our hands. When you feel the warmth, we put, if you're wearing glasses, remove glasses, put it over the eyes as a cup. Let the eyes take all the heat. Then you massage your forehead, neck, the powerful relaxation of our eyes and upper part. This is a relaxation of the hand. It's called like a baby fist. The baby does a fist, they put a thumb inside and close. We put it hands in the front and we breathe in, breathe out, we close our fist. Wrist gets relaxed in extension and get tightened in flexion. We do a relaxation, and by the time you can do it here, you can see, I can put my wrist all the way down and I'm totally relaxing my wrist joint. This is called prayer pose to the back. When you're able to do prayer pose to the back, the whole upper part of the body gets relaxed. This is a shoulder relaxation. You try to put your elbows together, slowly, gently rotate. This is called your feet. When your toes are separated, your feet get relaxed. This is the way we do it. You know, the market is full of it. They call it yoga toes, yoga socks, yoga shoes. We relax our ankle joint because ankle is the joint which carries all of our body weight. This is called a grinding. It's a very important pose we practice. We do it all daily practice. Daily we do 1 hour of practice, 25 minutes of asanas, the pose, 25 minutes of pranayama, the breathing practice, and 10 minutes of meditation. This is called sitting forward bend. very relaxed posture. This is relaxation of the knees, relaxation of the hips. Able to sit down is called your butterfly pose, tiddly pose. This is able to touch your body in the front, called Yoga Mudra. And this is your neck relaxation. There are 4 postures, putting the neck in the back, in the front, on the side, looking all the way to the back, and the neck rotation with your breathing. You breathe in before a muscle needs oxygen. So when the muscle is relaxed, you breathe in for your oxygen and you breathe out when the muscle is contracting. That is a little rule. And when you do it, it is always you practice same way. We do a breathing technique, about almost 7 breathing techniques. First one is called a bellows. Bellows is like your active inhalation, active exhalation. We raise our hand and take a deep breath in and then breathe out. This is the way we wash away all of our carbon dioxide, bring more oxygen in, and oxygen, as I said, combines with glucose. It produces your carbon dioxide, water, and ATP, and we get rid of all of your lactic acid, pyruvic acid, pain-producing substances, which comes from your anaerobic glycolysis, like not having enough oxygen. This is called a forehead shining breathing. It's active exhalation. We push it through your belly button in the back. All the air comes out through your nostril. I have all of them in my DVD, and I have all of them in YouTube. I have in the Facebook. In fact, this is in the Facebook Live now. This is also getting recorded. And all of you are interested, you can come to my class. Now we're doing a virtual class on Saturday morning at 9:30 on my Facebook page. And also I do it in a studio here locally when we will have the social distancing will be lifted. This is called breath holding and exhalation. You breathe in first, then take a breathe out completely, suck your stomach in and hold. That gives you a sensation, a proper relaxation of the lower part of the body, which also affects in the upper part. This is also another technique. It's called the Agnisar Kriya. You move your abdominal wall, you massage the organs inside. We do a lot of hand gestures called Mudras. This quiet down our mind. We do it all the time during our practices. This is called a corpse pose, Savasana, which is wonderful relaxation. And this is a one asana we recommend. This is a very all the way to the end. You don't have to do it. You start in stages, whatever you can do. This is called a fish pose. And you can see it stimulates a lot of areas in the throat, the face. Very powerful tool for your sleep apnea. These are the stages. I just said, these are all my pictures. I have learned this thing in stages. Now I can do any poses, any yoga asanas you name, I can do it. This is your called a shoulder stand with a lotus pose. And this is called your plow. And slowly and slowly you'll see. The next one we do called alternate nostril breathing. The left nostril is controlled by right brain, right nostril is controlled by left brain. So by able to do alternate nostril breathing, we activate both sides of the brain and we correct most of called the lateralization. Like I'm using my right hand, I'm always using my left brain, how to correct the lateralization. This is a nice technique, which is called a breath holding. We took a little pinch, we take a deep breath in, we hold, and slowly we drop your neck down for the chin to touch your chest. This is called a chin lock. In a chin lock, it stimulates your carotid sinuses, both sides, which is a profound relaxation response over cardiovascular system and your nervous system. And this is the one we recommend for your insomnia and your sleep apnea, both. This is called a bumblebee breathing, Bhramri Pranayam. We put our index finger in the forehead. We use 3 fingers to close our eyes, use a thumb to close our ear, Then you breathe out through your nose first, take a deep breath in, and breathe out with the sound of a bee, like So underlying physiology is you have shut down all of your five senses, then you created a vibration, and the brain has a vibration. A two vibration interacts, it's called harmonic resonance. And the mind and the brain goes into a very calm state. This is called victorious breathing, called Ujjayi Pranayama. As I explained to you at the beginning, it is able to gently relax and sort of tightens up your larynx. Try to breathe in, activates your vagus nerve through superior inferior laryngeal nerve, and the efferent comes through glossopharyngeal and hypoglossal nerve, which really tightens up your soft palate through palatopharyngeus and palatoglossus muscle, and also pushes the tongue in front. So that, like, just to demonstrate what it is, you try to squeeze it and try to breathe in. I can continue for a long, long time because I've been practicing. In fact, I practice every single day. These are just showing it to you, the techniques we use, able to touch the chin to the chest. We have seen. And as I said, I have not seen any yogis, yoga practitioners having insomnia or sleep apnea. These are called observational signs, you know. So again, just to show it to you that I never knew even what is a headstand before, you know, but slowly in stages. This is called a headstand, which creates a baroreceptor sensitivity and reduction of the chemoreceptor sensitivity. You sit down, this is called a Vajrasana, very powerful relaxation. Put your head down and keep your head down for 1 week, 2 weeks, and slowly, the baroreceptive sensitivity comes in, intracranial pressure comes down, intraocular pressure comes down. Slowly you can see the stages, your body goes high up and able to stay. In this posture, your homeostasis sets in, pressure inside your popliteal artery and pressure inside your carotid artery. We have done it. We have done all the Doppler studies. In fact, these days we have an Apple Watch, and in the Apple Watch, we record all of our body physiology function, and we see the effect of yoga in our body and mind. And these are the few patients, you know, I have, but let's show for the sake of time, the people who got better with their yoga therapy practices. And I want to show you that what is the state of yoga therapy. And next couple of minutes, I'm going to finish. We'll have about 10 minutes for question and answer. The new medical school is called the Oakland University in Michigan, Bowman School of Medicine. First school where they have a yoga therapy with a full-time yoga therapist in the school. These are, you know, NIH website, and they have all about yoga. This is called International Association of Yoga Therapists. I've been a president for 5 years for that. These are their annual conferences. This is a journal called International Journal of Yoga Therapy, peer-reviewed journal. And there's a conference in Harvard called Second International Conference on Yoga and Ayurveda. There is a conference which I was a keynote speaker, Yoga as a Lifestyle Medicine in Smithsonian. This is my book called Yoga Therapy, Ayurveda and Western Medicine, A Healthy Convergence. And then this is selling very well because it's almost like a textbook. It is like a textbook. You can take a look. This is my DVD. There's a lot of books in the market. Yoga as a medicine, meditation as a medicine, yoga therapy and integrative medicine, principle and practice of yoga, yoga therapy and reference. So let me finish with you to show you. These are all the articles being published in established yoga journals. And just to show it to you, that primary prevention, when you are genetically predisposed for a disease, if you continue the relaxation response, genetic suppression prevent onset of the disease. And Cleveland Clinic has all the programs to use as they call it primary prevention. Secondary prevention is you have a genetic predisposition, you did something in your lifestyle, which is called epigenetics, and you have the disease. You have a heart disease, you have a cancer, but you get all treatment, surgery, radiation, chemotherapy. Now you incorporate your relaxation response, genetic suppression, prevents progression or reversal of the disease. Tertiary prevention prevents complication. And also, when you have an underlying condition and do a daily practice of yoga, what we have seen is a better management of the disease, less pharmaceutical support, and a better quality of life. If you go ahead and go to my website, and you will see almost 2001, I had a triple vessel coronary bypass, and I had to retire after that. Now, with a daily practice of yoga, I'm enjoying a quality of life. So yoga therapy is relaxation, as I said, and let me finish with you. These are all, to showing the physicians how yoga therapy works from our medical standpoint. This is the one which we measure all your echocardiogram, the Dopplers. This is to show somebody in a headstand what it looks like. That we learn yoga from our baby. If you look at a baby, every posture baby does is a yoga. So a friend of ours who took a picture of all the babies. So the baby will stand up naturally in a mountain pose, tree pose. This is called your thunderbolt, easy pose. They get up into a cobra pose. They get into, it's called your locust pose. It's called a cat pose. See, wonderful. The babies, every posture the babies do, we try to do it on our own and see how easily baby does it. This is called a child's pose. We do a child's pose when you're very anxious, when you're very uptight. This is the way baby sleeps. So if you have insomnia, this is our recommendation. You sleep like this. Put both the feet together. It's called reclining bound angle pose, and do your breathing exhalation longer than inhalation. I finish with my last slide. I put it all the time. We call it a illness and wellness. We call it illness starts with I, wellness starts with we, and then we say, when we convert I to we achieve our wellness and health and healing for our everybody. So let me finish here. We have a few minutes. I will be able to answer any questions if you have, and any comments, because we have been doing it for a long time. Let me show it down. Let me get a speaker view.
Dr. Sarkar.
Yes.
Have you ever heard of a gentleman by the name of Wim Hof? He uses similar breathing techniques. He is the gentleman. He does a lot of these ultra marathons and barefoot, and climbs mountains in extreme conditions with shorts on. Have you heard of?
Yes.
Yeah.
Yes. I heard about him, and what he does, primarily, it's called a hyperventilation syndrome. He does a very rapid breathing, and the rapid breathing, what it does, it creates a hyperventilation syndrome, which primarily affects call it vasoconstriction of the cerebral vessels. So you develop an altered sense of consciousness. Then also, because of your respiratory alkalosis, you develop, low calcium, you get a little bit of a carpopedal spasm, circummoral numbness, and he is using it actually for as one of the therapy for insomnia and sleep apnea. And I heard him, and he talks about it. And primarily, if you look at it, the whole practice is very extreme. And it's the mechanism is the hyperventilation syndrome, creating an altered sense of consciousness.
So that it helps him to deal with the pain, so it doesn't bother him?
No, this is a pain powerful tool, because when it's an altered sense of consciousness, you really don't feel any pain. You know, think about it. You know, a person who is taking a pain medication, what is the primary effect? Is an altered sense of consciousness, you know. And then if you even a person, you can think about, you know, not going extreme, somebody who's addicted, even somebody who puts a first, you know, shoots a drug, you know, what are you going to say? Oh my God, look at this sensation I have. And it's all quieting down your mind, and primarily what you need for your insomnia and all the concept of sleep apnea, you know, central, local, everything. But the moment we keep our nostril open at night, when there is no dryness, like I always put a humidifier. I always have a humidifier in my bedroom. I have the humidistat, like I can set up 45%, 50%. It goes on through the whole year. Because if the humidity is too high, it shuts down anyway. I have a humidity in my bedroom. I use a oleation in my nostril every night before going to bed. Every morning, I do a tongue scraping and the washing your nostril called your neti pot using. And even if I sleep, my wife say, you know, you breathe out longer than breathing in. Your exhalation is longer than inhalation.
It's interesting. I do think that an overactive sympathetic tone has a lot to do with PTSD and insomnia. And in fact, some physicians at the VA are doing stellate ganglion blocks on veterans who are coming back with severe PTSD. And these stellate ganglion blocks are quieting down their sympathetic drive, and are actually showing that they're having incredible results with a single stellate ganglion block injection.
Exactly. It's a stellate ganglion block, and if we look at stellate ganglion block is nothing but blocking the sympathetic tone. Any exercise for CPAP user? Yes, you know, I have a question here. Any exercise for CPAP users? Yes. The primarily exercise for CPAP users are first, you know, using a relaxation, exercising on neck and relaxation. The way to do it is that just show you briefly. We do the breathing. First, we breathe out first, then the breathing in, slowly drop our neck to the back, and breathe out, slowly put our neck in the front. What you're looking for, pain. If there is any pain, we back off. If there is no pain, we slowly stay in this posture, and then you look for our breathing. And if it's effortless breathing, we stay here and slowly do it again with the breathing. Breathe in, breathe out. Second, from the center, the middle part, we breathe in first, drop your neck to one side. And same breathing cycle, you come back in the middle. Do it in the opposite side. Third, you breathe it in the middle. Slowly look all the way to the back. All the way to the back. Slowly come back in the middle. Finally, drop your head down. Breathe in. Slowly rotate to your left, to the back, to the right, and in the front. We do it about maybe 5, 10 times. We let the patient say that you do it as long as your body will allow you, as long as you don't have any pain, as long as your breathing is effortless. And the other thing we recommend to the CPAP people is to do this. The breathing is called the Ujjayi Pranayama. The way to do it like this, we breathe out first, take a deep breath in, completely breathe out. I can do it, you know, I've been doing it for a long time. I have no problem. Now see, I'm effortless. I'm talking, I'm breathing. It activates your glossopharyngeal nerve and hypoglossal nerve. And then we ask them to do a little bit of tongue scraping. You know, tongue scraping, by removing the coating in the tongue, it also massages, stimulates your tongue. So if you think about the physiologically, why do you have a sleep apnea? For the tongue to drop back, it helps the tongue to push in the front. Any other question? Dr. Nye still here?
Yes, sir.
Okay.
Thank you very much. That was very good. Appreciate it.
Okay, and let me know. Actually, if you guys have a time, I can come even demonstrate, so you guys can pick up some of the techniques. I practice every single day. I don't have any issue. Okay. Thank you for your
Wonderful.
time.
Thank you, Dr. Sarkar. Appreciate it.
Okay. These days, this is the only way to teach, the virtual way. Okay.
Thank you, sir.
Bye-bye.
Bye now.